with help, assistance sent by the Ministry of Health regarding there was a research we did earlier here at both Kachola Beach Field, and we realized that this is one of the high HIV prevalence zones in the Victoria Basin. So, as the ministry, we have a lot of things that we really came across, and to realize that the spread of HIV and AIDS, HIV in this community was driven by several behaviors. And we have the behavioral drivers related to HIV spread in this community. As you know, this community, mostly the economic activity is fishing. And we realized that one of the key behavioral drivers related to HIV and AIDS transmission, we have what's called the Jaboya practice. Jaboya practice, this is whereby female fish traders engage in sexual activities, or they exchange sex for fish with fishermen, which also increases the chances of HIV transmission in the lake region. So the second point is multiple sexual partners. Multiple sexual partners, more than one partner. This also increases the chances of HIV transmission, because you can't tell me that you will keep on changing partners, or maybe you have multiple partners, because you don't know. Maybe some of them, maybe they have the infection, and that's how the HIV has been spreading in this field. So we also had villagers at least to stick with one partner to ensure that HIV will prevent the transmission of HIV. Then at that point, we also realized that there is low condom use. Our fishermen don't use condoms during sexual intercourse, which also put them at risk of getting HIV infections. We have alcohol and drug abuse. Alcohol and drug abuse. As you know that you can't abuse drugs, and you tell us that your reasoning will be the same. You tend on making silly decisions, sleeping with women without protecting yourself, and you end up getting the virus. We have stigma and discrimination, the fear of getting tested. Because you fear you get discriminated by other people, village mates. So, and with me today, I have the IEC materials. You have the information, educational communication materials. We have posters. So those posters we have described how you can properly use a condom. Use a condom. We have the steps of HIV testing. What you are supposed to do before and after testing. And then we have the brochures that I'm going to give you later, so you can read later. It has all the information about HIV and AIDS, how you can prevent yourselves, everything. So I'm going to give out later, and you will read. So we are going to have a short health education session, whereby I'm going to ask questions, and you are going to correspond to my questions. How do you know HIV and AIDS? What comes to your mind? For example, when you hear about HIV?
First of all, HIV is a virus. That's the first thing. When I hear a word, somebody told me, no, I read it somewhere, HIV. It is a virus.
Yeah. Yes. It is true. And how is HIV spread?
They normally spread by sexual and protected sexual intercourse.
Yes.
Sharp object sharing of sharp objects.
It is it's correct. Very correct. So we have the key HIV prevention messages that I'm going to explain to you. Message number 1, you have correct condom use. In the poster that I gave earlier, we have all the procedures of using a condom correctly, so that you protect yourself from HIV. And also, we also encourage you guys to go for HIV testing and counseling. It can also help also to detect the infections earlier, and that will help also to prevent the spread of HIV. And also we have PrEP for the most at-risk groups, especially fishermen. We have sexual workers, and we also urge you guys to be faithful to one partner. That also reduces the chances of spreading HIV. Just maintain your partner. That will also help. Avoid alcohol and drug abuse, which is also a major risk factor of HIV transmission. Go for early treatment with ART to regulate the HIV virus. And people living with HIV, we should also respect them. They are our brothers and sisters. Some of them, they did not get the virus maybe because they wanted it. Maybe it was by mistake. They were driven maybe by drugs and alcohol. So we must respect them. Let's treat them well, and it will be better. Because HIV is manageable. It is manageable. They can live longer. So we should not fear. We cannot treat it 100%, but you can manage it. So maybe if I can give room for questions, maybe if someone wants to an explanation, maybe he or she, maybe she doesn't understand some.
Yes, let me ask a question. I have a question. If somebody living in a remote area, yes, or a unit, and one of these fine days, you get a lady and they started arguing about the love, then after this station, they became agreed on this station. So this man, let me record it. This man, he didn't have the condoms, and they never got near there. Understand there is a remote area that is, there is no facility around, and then this guy he decided to do sex, and he didn't know this is the result. How as a actor, how are you advise this guy?
So I advise this young man to, if you did unprotected sex, first of all, if you do unprotected sex and maybe you don't trust the lady that you will get with, so you have to rush the health facility at least within 72 hours. Yeah, for you to be administered on preps. Maybe you can, at least we have chances of you not getting the infection, yeah, of disease. And also, to advise other young men, if you cannot access a condom and maybe you don't trust your partner, just abstain. Yeah, it's not the must you do sex. Just postpone it, maybe until you go test yourselves, or even until the day you have a condom. So, ladies and gentlemen, as I conclude, to advise you, the community members, on the matters of HIV and ladies, the first thing, let's emphasize on the use of condoms. Because condoms, at least 100%, they can prevent HIV by the use of condoms. Let us test, regularly testing. It is also important because you can, maybe you can get, maybe you have the infection. So you can go for early treatment, which can also help for you guys to avoid spreading the virus, avoid risky behavior. Yeah, there are some behaviors like the use of alcohol and drug abuse that can cause. And please, let's also support people living with HIV and AIDS. Yeah, because there are people, let's encourage them, because they also have children to take care of. And that's all for today. And I wish you all the best.